Hi, I'm Dr. Nikhil Nasta and I'm from Eyesight Eye Care and Surgery, Mumbai. In today's video, we're going to talk of something very interesting. We are going to talk about how to select the intraocular lens. Now, what is this I'm talking about? Many of us have a cataract, or somebody in our house has been diagnosed with a cataract and the doctor told you to get a cataract operation done. ठीक है, करेंगे, मगर what kind of lens should I select? He gave me so many options. How do I know which is the correct lens for my relative or for my wife or even for me in that matter? So let's understand what are we talking about. A cataract is a cloudy opacity in your normal lens which is present in the eye. This lens is like a camera ka focus. So it helps you to focus rays onto the retina and give an image to your brain. In cataract, we are removing this lens which has become opaque, जो अभी ट्रांसपेरेंट नहीं है, हम उसे निकालेंगे. So what do we do then? We need to replace with something else. That what we replace it with is called the intraocular lens or a short form IOL. Now this IOL can be a hard lens. If you take a hard lens, then you have to go in for a big incision surgery, which is not really recommended. We are nowadays talking about laser surgery, advanced cataract surgery. No injection, no stitch, no pad, that kind of a surgery. In this, the incision is just a 2.2 millimeter micro incision. Beautiful. Now for the micro incision to work to your benefit, you need a lens that will go in through that small 2.2. So we need a lens which is more soft, which is of a softer material, acrylic, silicone. Now this kind of a lens is called a foldable lens implant. Basic criteria, we want a foldable lens implant. Okay. Now in this we have options of an Indian or an imported. Doesn't matter really. Job of the lens is to see, and whether you put an Indian or an imported, you're going to see. So go by whatever your budget or your Mediclaim policy or your monetary requirement fits. Don't stretch for that. Now if you go for with the cataract surgery, you also want to correct your number. मुझे चश्मा पहनना ही नहीं है. So there are special lenses here which will focus for far also, which will focus for near also. These lenses which focus for far and near, just like you wear chashma, you wear it for far only. So if you make a lens only for far, then it's a monofocal lens. This will correct your number for distance but not correct your number for near. So even after cataract, you will wear a chashma. Many people ask, "Arey doctor, if I put a lens, why I have to wear glasses now?" Because you went for a monofocal lens. Anybody who's a diabetic, who has high pressure, who has any problems in the eye, or a very old patient who's not suitable, the doctor will guide you. Then they will not give you the option of a bifocal lens. So don't be disheartened. Whatever has been done for you is the best. If the doctor offers you a multifocal lens or a bifocal lens, then you have the beauty that when you remove your cataract, at the same time you can be spectacle free also. Then you need not wear chashma for far also, for near also. This is with a bifocal lens. But with these lenses, sometimes some people can't see that, a ticker on the TV or the match ka score or something at an in-between distance, because that is not corrected. It's a bifocal lens. There is another option called a trifocal lens. In a trifocal lens or a panoptic kind of a lens, it's like a progressive chashma. So you have computer distance also, you have TV distance also, you have far away distance also for the train monitors and other things. You have your checkbook signing and the whole range of vision. These are called trifocal lenses. So these are a good option also. Depending on these criteria and what are your requirements, and of course the pocket has to suit you, because the more advanced you go, the more expensive the treatment will also become. Another thing to remember, some of you will have a cylinder number where we have an axis power, -1 at so and so degrees. Don't bother to understand what it is. This is something called astigmatism. This is corrected with a special astigmatic lens which is called a toric lens. So toric lens comes in the same option, monofocal, multifocal, trifocal. Just like you selected that, whatever you want, the doctor will fit you in with an astigmatic lens if that is your requirement, and the cost will escalate a little more. You're ready to pay for your iPhones and your branded shoes and your bags and everything else, but this you will find costly. Now you got to weigh the value versus the price. What price are you paying and what is the value? The value is the quality of life, the wow factor. Not depending on glasses at all. You'll be like a young kid, you can see everything. I feel it's well worth it. It's your eyes and you deserve the best. Make a very sensible choice. If you need any more videos or any more, you like these kind of videos, you can always log on to Librate and get a hold of many more. Okay, so all the best for you and make a wise choice. Bye bye. Thank you.